So thank you for coming in today. I got a general idea of what's been going on through UCSD CAPS and through your intake form. Based on what I've heard, I believe that you're likely experiencing something called major depressive disorder. I think Prozac could be helpful. Now, there's no need to feel any sort of shame around this. Many people develop mental illness, and in most cases, it is very treatable.
What exactly is Prozac?
Prozac, also known as fluoxetine, is an antidepressant of the selective serotonin reuptake inhibitor type. Best being known for treating depression, Prozac also has many other disorders that it can treat. What are SSRIs? SSRIs are selective serotonin reuptake inhibitors. Serotonin, seen here, is a neurotransmitter that plays a key role in regulating mood, along with other functions. SSRIs block the reabsorption of serotonin in the brain, increasing the concentration within the synaptic gap between neurons, which has been shown to increase mood in people who are depressed. SSRIs also enhance neurotransmitter activity in other regions of the brain. The way that SSRIs work, as mentioned, is that they block the reuptake of serotonin from the synaptic cleft into the neuron. They do this by blocking the reuptake pumps that are responsible for removing the serotonin from that space, increasing the concentration available for signaling. Also, consistent exposure leads to downregulation of 2-HT1A receptors, which help improve stress tolerance and increase expression of brain-derived neurotrophic factor. Metabolites of Prozac also act as serotonin reuptake inhibitors, which help prolong the duration of effect. Other conditions that are treated by Prozac include, but are not limited to, bulimia nervosa, obsessive-compulsive disorder, panic disorder, anxiety, and premenstrual dysphoric disorder.
Yeah, so as I mentioned, I'm a chemistry student taking a chemistry class with the best professor ever. And I was wondering how the structure of Prozac affects its activity, and then also how it breaks down in the body.
Those are very good questions. Let's discuss the structure-activity relationship and its metabolic breakdown of Prozac.
First, we will look at the aromatic rings. As you can see on the picture here, Prozac actually has 2 aromatic rings, and these aromatic rings are actually very important functional groups to help Prozac interact with serotonin transporters. Because Prozac is an SSRI, it basically inhibits the serotonin transporters, or SERT, from efficiently reabsorbing the serotonin, and by blocking SERT, the Prozac prolongs the time that serotonin remains in the synaptic cleft. This increases the serotonin levels at the junction, enhancing serotonin's signaling function. The second functional group to examine on Prozac is its nitrogen group. That's a pretty strong hydrogen bond donor that interacts with SERT directly as well. And then another aspect to look at Prozac is the substituent. The trifluoromethyl group is a very special substituent relative to the SSRI families compared to another SSRI like Zoloft or citrulline. Instead of this really cool trifluoromethyl group, Zoloft has a chlorine atom. For Prozac specifically, trifluoromethyl group actually protects the reactive methyl group from the metabolic oxidation, and this ensures that the drug remains stable and active in the body for a longer period of time, which also helps explain why Prozac has a longer half-life. And lastly, we'll look at the stereochemistry. This is always really super important to many drugs, as the spatial arrangement of the atoms in the molecules may influence its activities with the transporters. But surprisingly, people in Eli Lilly, or the researchers at Eli Lilly laboratories, tested this hypothesis, and to their surprise, they actually found only a very slight difference in activity between enantiomers, regardless of the species or pharmacological tests. So there's little antiospecificity regarding the interactions of fluoxetine and the serotonin uptake carriers, as you can see below. If we focus on the left, we see an enzyme protein called CYP2C19, and this protein enzyme has instructions to make enzymes in the liver cells for endoplasmic reticulums, which are organelles that are responsible for processing and transport, and to get from fluoxetine to p-trifluoromethylphenol, which is number 14, undergoes oxalative O dealkylation. And on our right, we see 2 other enzyme proteins such as CYP2D6, and CYP2C9. These are also enzyme proteins that prevent dose-related adverse effects from the antidepressant Prozac. And CYP2C9 is actually a very abundant gene that makes a protein to further promote oxidation of Prozac.
Doctor, that's good, but how long has Prozac been around for? Like, how do I know I can trust it?
Yeah, we can talk about the history and the FDA approval process for sure.
Okay, thank you so much. Okay.
Prozac was developed by scientists at Eli Lilly and Company in the 1970s. It received approval from the FDA in December of 1987 for the treatment of major depressive disorder, or MDD. Prozac quickly gained popularity and became one of the most prescribed antidepressants worldwide because it had relatively less side effects than older antidepressants. Despite its widespread use and efficacy for many patients, Prozac has faced controversies and criticisms over the years. Some concerns about the risks were raised when research revealed that it increased suicidal ideation by 2% among populations under the age of 18. In the United States, Prozac's patent expired in 2001, leading to the availability of generic versions of fluoxetine. This had made the medication more affordable and accessible to patients. Prozac remains an important and widely prescribed treatment for depression, anxiety disorders, and other conditions. According to Ginger and Peter Bregan in their book titled Talking Back to Prozac, only 63 patients were followed for more than 2 years before the drug's approval to examine its long-term effects. Additionally, seriously suicidal and hospitalized patients were excluded, and participants were allowed to take sedatives and minor tranquilizers to overcome Prozac's stimulant-like effects. After weeding out the most flawed studies, the FDA only found 4 that were adequate to consider, and 1 showed that Prozac was no better than a placebo. Finally, only 286 out of 5,000 patients finished the 4 to 6 week trials used to determine Prozac's efficacy.
I would be remiss if I didn't talk about the possible side effects that one could experience when taking Prozac.
Sounds okay, yeah.
So if you start to feel any of these side effects, we can always adjust the dosage and then combat those issues with that.
Okay, that sounds good.
Patients tend to experience side effects that can either be categorized as psychological or physical. The most common psychological side effects are increased nervousness, unusual dreams, and confusion, while the most severe are agitation, extreme confusion, and hallucinations. Common physical side effects are insomnia, nausea, diarrhea, and dry mouth, with the most severe being irregular heartbeat, fainting, seizures, and abnormal bleeding or bruising. Side effects such as anxiety and insomnia, as well as agitation, are thought to be due to the 5-HT2C receptor antagonism. Fluoxetine is administered orally to the patient. It is taken once a day in the morning or in the evening. Dosage levels exist in oral solution at 20 milligrams, tablet at 10, 20, and 60 milligrams, capsule at 10, 20, and 40 milligrams, and delayed release capsules at 90 milligrams. Depending on the disorder, the dosage of the medication will vary. Specifically with major depressive disorder, 20 milligrams to 40 milligrams is generally the desired amount for effectiveness. After 4 to 6 weeks, doctors will determine the appropriate dosage level depending on the side effects that a patient is experiencing.
Before we begin your treatment on Prozac, I need to know if you have any pre-existing conditions, because it can be dangerous for you to take this med if you have any of them.
Check with your doctor before taking it if you have ever had an allergic reaction to fluoxetine or any other medicine, have a heart problem, as fluoxetine can make your heartbeat faster or cause an irregular heartbeat, aka arrhythmia, are trying to become pregnant, are pregnant, or you are breastfeeding, have glaucoma. Fluoxetine can increase the pressure in your eye, have epilepsy, or are having electroconvulsive treatment. Fluoxetine may increase the risk of having a seizure.
No, I don't believe I have any of those.
Okay, well, glad to hear it. Hopefully with the right dose and therapy and plenty of support, you'll be feeling better soon.